Continue. 314. Which of the following procedures requires a patient to refrain from strenuous exercise for 12 hours prior to the test? Glucose tolerance test. 315. Which of the following tests requires that a patient fast prior to collection of the blood specimen? Glucose tolerance testing. 316. Introducing bacteria from a patient's skin into a specimen for food culture analysis may result in false positive results. (317) Introducing iodine into a specimen for blood culture analysis can result in false negative results. (318) Repalpitating a site prior to venipuncture for blood culture analysis may result in false positive results. 319. Introducing air into an anaerobic blood culture collection container may result in false negative results. 320. Which of the following conventional stopper colors corresponds to the evacuated tube suitable for blood culture specimen collection? Yellow. 321. Which of the following evacuated tube additives inhibits complement? SPS. 322. Which of the following tests would be most affected by a lack of proper patient preparation? Type and cross match. 323. Which of the following blood culture specimen collection containers incorporates an aerobic bottle and an anaerobic bottle? Bactec system. 324. While performing a venipuncture with a syringe, a phlebotomist notices blood frothing between the hub and the needle and the syringe. As a result, the specimen may be hemolyzed. 325. A specimen collected by syringe is hemolyzed. What may have caused this? Forcefully drawing back the plunger. 326. Following venipuncture by a syringe, blood must be aliquoted into the following evacuated tubes: red, sky blue, green. In what order should the evacuated tubes be filled? sky blue, green, red. 327. The rationale for the order of draw for syringes is to minimize clotting in anticoagulant tubes. 328. Which of the following is increased compared with the antecubital fossa on the skin surface of the hand? Bacteria. 329. Which step in the venipuncture procedure must the phlebotomist exercise extra care in performing when collecting blood by venipuncture from a hand vein? Anchoring the vein. 330. Why is the fifth finger of a patient's hand routinely eliminated as a potential site for skin puncture? The tissue is thinner than other fingers. 331. Why is the index finger of a patient's hand routinely eliminated as a potential site for skin puncture? The tissue is thinner than other fingers. 332. Which of the following blood constituents may be falsely elevated if the skin puncture site is prepared with povidone iodine? Potassium. 333. Which of the following constituents is present in higher concentrations in blood collected by skin puncture than in blood collected by venipuncture? Glucose. 334. Which of the following skin puncture specimens is most likely to be adversely affected by excessive squeezing of the site? Bilirubin test from a 12-hour-old neonate. 335. Positioning a patient's arm downward prior to venipuncture will help prevent reflux. REFLUX. 336. A phlebotomist attempts a venipuncture on a patient's basilic vein. If the blood that appears in the evacuated tube is dark purple red, the phlebotomist should allow the tube to fill, following standard procedures. 337. A phlebotomist selects a 4.5 milliliter sodium citrate tube to collect a patient's specimen. The patient was difficult to draw, but the phlebotomist successfully collected approximately 3.0 milliliter of specimen into the sodium citrate tube. The phlebotomist should next recollect the specimen. (338) If a patient's arms and hands are swollen due to excessive fluid retention, this patient condition is called edema. (339) A specimen for ABG analysis would be rejected if the specimen contained air bubbles. (340) Clinically significant changes will occur in a specimen collected for ABG analysis if the specimen is left at room temperature for more than 5 to 10 minutes. (341) A phlebotomist attempts an arterial puncture of the brachial artery. If the blood appearing in the syringe is bright orange red, the phlebotomist should continue the procedure. (342) Which of the following situations will be caused if too much heparin is in the syringe used to collect a specimen for ABG analysis? Acidosis of the specimen. (343) A syringe used for collection of ABG samples should be gas impermeable. (344) What is the maximum number of venipuncture attempts a phlebotomist should make to secure a specimen? 2. (345) What is the maximum length of time that a tourniquet may be left on a patient's arm without adversely affecting test results? 1 minute. (346) Which of the following evacuated tubes must always be preceded by a discard tube? Sky blue. (347) What is the maximum number of times a phlebotomist should perform skin puncture on an infant's foot to secure a specimen? 2. And that is the end of chapter 2, which was specimen collection.